Hello, Assalamu alaikum. Hope that you all are fine. Today I am discussing about the infectious bronchitis, a very important poultry disease. I am Dr. Jahazeb. I am here to tell you about what infectious bronchitis causes in poultry. This article explores the causes, transmission, clinical signs, and prevention of this disease. Additionally, the economical losses associated with infectious bronchitis will be discussed in this lecture. Causes of infectious bronchitis. Infectious bronchitis is caused by a coronavirus. Infectious bronchitis, also known as gasping disease, is a highly infectious respiratory disease that affects chicken of all ages. Transmission of infectious bronchitis. Infectious bronchitis is transmitted through aerosol between flocks and farms. It is also transmitted through ingestion of contaminated feed and water. Contaminated equipments and personnel are also responsible for the transmission of infectious bronchitis. Egg transmission is not commonly reported in infectious bronchitis, so it is not transmitted through the egg. It is worth noting that infectious bronchitis virus is not highly resistant and easily loses its infectivity under adverse conditions. Species affected. Chickens are the natural host for infectious bronchitis, and birds under 10 to 12 weeks of age are generally more severely affected than older birds. Maternal immunity through vaccination provides some protection to the birds. Clinical signs: rales, gasping, sneezing, and watery nasal discharge. In young chicks, depression, huddling together under the heat source, reduced feed consumption, and poor feed conversion may be observed. Significant decrease in egg production with poor egg quality. Affected birds loses their youthful appearance, exhibit worn out feathers, and may start molting. Respiratory distress, depression, dehydration, ruffled feathers, and watery diarrhea. Mortality rates depend on the virulence of the virus serotype and the immune status of the postmortem lesions, serous exudate in the trachea, mild air vesiculitis, and pneumonia. Next is hyperemic tracheal mucosa, nasal passages, and sinuses. Cheesy plugs may be found in the lower trachea or at the bifurcation of the bronchi. Poor quality eggs, watery egg albumin, and permanent damage to the oviducts in birds are common. Pale kidneys with distended ureters have been observed in infectious bronchitis. It is also seen that embryos do not grow, and stunting embryos are seen at 14 days of the growth. Differential diagnosis of the infectious bronchitis. Infectious bronchitis can be differentiated from infectious laryngotracheitis. In infectious bronchitis, virus infection of the chicken causes damage to the upper and the lower respiratory tract, while in infectious laryngotracheitis, the virus damages only the upper respiratory tract. Diagnosis of infectious bronchitis. Infectious bronchitis can be diagnosed by demonstration of a rise in antibody titer against infectious bronchitis virus by ELISA. Hemagglutination test and virus neutralization test can be used for the diagnosis of infectious bronchitis when there is history of respiratory disease or reduced egg production. Prevention and control of infectious bronchitis. So first of all, vaccination program is essential in preventing infectious bronchitis. Good management practices such as maintaining strict hygiene through regular cleaning and disinfection are vital in controlling infectious bronchitis. Treatment of the infectious bronchitis. There is no specific treatment for infectious bronchitis in poultry. Supportive treatment with antibiotics to control secondary bacterial infection could be more beneficial. Infected flocks should be isolated to prevent the spread of disease to other flocks. Here is the doxycycline is a great antibiotic against mycoplasma. It can be a secondary bacterial infection in infectious bronchitis, and doxycycline is more effective to control mycoplasma to minimize the losses due to infectious bronchitis. Tylosine can also be used alone, but is used it with doxycycline is more beneficial than using it alone. Here is the lincomycin combined with spectinomycin is water-soluble antibiotic. It works well and has no withholding period for the egg layers. Thank you viewers for watching this video. Hope that you have learned a lot. Like my video and subscribe my channel. Thank you very much. Allah Hafiz.